Have you ever wondered why we don't usually evaluate people trying to get pregnant until after 1 year of them trying? And by trying, we mean having regular, penetrative, vaginal intercourse without the use of condoms or any hormonal contraceptives. Some of you are not having regular sexual intercourse and yet you expect to get pregnant. How? I had a patient come in for evaluation, and when I asked her about coital frequency, she said she and her husband, they've not done it in months. And in my mind, I'm wondering, so why am I evaluating you for infertility? Why am I trying to get you pregnant if the basic thing you're supposed to do, you're not doing? So first things first, you cannot get pregnant if you don't have sex. It's normal, except you're Virgin Mary. Second, you can't get pregnant if you have sex every single day after you have ovulated and the eggs have died. And that's why there is a particular period, there's something called the fertile period whereby the chances of you getting pregnant is higher. So most of the time, by the time we explain timed intercourse, fertile period, most people will actually get pregnant. Now, for those having intercourse 3 to 4 times per week or during their fertile period, and they're not using condoms, they're not on any method of family planning, the men are actually ejaculating inside the vagina, the chances of getting pregnant every month or per cycle is just about 20 to 25%. So don't get worried if you did not get pregnant in the first month or the first couple of months. Now, by the 12th month of regular everything I've said, about 80 to 85% of women will get pregnant, and this increases by the 2nd year and by the 3rd year. And that is why we don't usually evaluate within the 1st year, because really, in the absence of anything, by the end of the 1st year, 8 to 9 out of 10 will actually get pregnant. So evaluating early just causes unnecessary tension, apprehension, emotional stress, and then you doing investigations that are not really necessary or important. But this 1 year rule has some exceptions. If you're above the age of 35, we wait 6 months. If you're above the age of 40, we have to evaluate you immediately. Why? Because the older you get, the lesser your fertility status and all that. Now, if you have any of the following conditions I'm going to list now, you must be evaluated immediately. We're not waiting 6 months, we're not waiting 1 year. So if you have irregular or absent ovulation, if you've been diagnosed with polycystic ovarian syndrome, if you've had pelvic inflammatory disease in the past, if you have endometriosis,